Hello, I'm Camille. I'm the physician associate seeing you today. Please take a seat. Can you confirm that your name is Sheila Ormsby? Okay, and can you please tell me your date of birth, please? 15th of January, 1950. Perfect. How can I help you today, Sheila? The back of your left leg is hurting. And when did it start hurting? 2 weeks ago. Can you explain in your own words what kind of pain you're feeling? Okay, the back of your leg is painful and tender, and it's itchy as well. Okay, and does it hurt anywhere else? No? Okay. And do you have any other symptoms or any other condition that you know of that might contribute to this presenting complaint? Okay, you have varicose veins in around that area and it's red. Okay. And the pain that you're talking about, is it continuous or does it come and go? It's constant. Okay. And is there an activity or something that you do that makes it worse or better? It's worse when you're standing up and sitting down for a long time. Okay, and how painful is it on a scale of 1 to 10? 8? Okay, and I'm just going to take your past medical history as well. You said that you've got varicose veins, and I could see that in here on your record. And it also says that your BMI is elevated, which means that your weight is a little higher than what a woman of your height is recommended to be. You don't have any prescribed medications, and do you take any other over-the-counter medications or herbal medicines? Oh, you've just started taking paracetamol since your leg is hurting. That's understandable. I'm with you there. Can I just ask, when you get cuts, for example, when you're wrapping gifts for Christmas, when you get paper cuts, how long before it stops bleeding? Not long? So it heals at a normal time, you think? Fantastic. And do you have any allergies that you know of? You're allergic to peanuts, okay. And how about your family? Are they doing well? Oh, that's great that they're doing well. Do you know of any conditions that run in your family? Diabetes and arthritis are common in your family. Okay, and how about your living situation? Do you live at home or do you live anywhere else? Do you like traveling? Okay, so you live at home and you don't travel much. And do you have someone living with you? Okay, your husband and your granddaughter staying with you. Must be a happy home. How old's your granddaughter? 20. Okay, so your husband and your granddaughter can help you around the house when you need help then, yes? Oh, great, that they're very caring. That's good. Do you have activities that you enjoy? You like gardening and watching TV? Okay. And it hurts when you're sitting down for a long time and you're watching and doing gardening? Okay, I understand. And how about outside the house? Do you have any other activities? Okay, so you've retired work, but you still volunteer for 3 hours in a charity shop in town. And your leg hurts when you stand for a long time when you do the volunteering. Okay. Do you do any exercises? So you walk 15 minutes with your dog in the morning and then another 15 minutes in the afternoon. That's brilliant. So there's just 2 things that I want to examine. First, your BMI. So we have to check your height, current height, and your current weight at the moment. And then we'll go on to examine your legs to see what's causing the pain. Is that okay? Perfect. So now can you just please walk to the corner there where the scale is? I'll be with you now in a second. Okay, yes, you can take your shoes off, please. Okay, so your current weight is 70 kilograms, and can you please just press your back on the wall and stand up as straight as you can so we can get your accurate height. You're 5'2". Okay, thank you so much. You can go and sit back down. Thank you. So calculating it, your BMI is currently still overweight, and this might cause some conditions, but we will happily help you make some treatment plans and make some plans to rectify this if you want to. Okay? Right, can you please walk behind those curtains? I'm going to close the curtains for you, and if you could please take your trousers off so we can have a look at your legs. You can keep your underwear on, and also someone's gonna have to be chaperoning us, so I'm gonna call one of the medical staff. They're gonna be professional. It's just so someone's watching to make sure that I'm not doing anything that I'm not meant to. Okay, is that okay with you? Okay, thank you. I'll be with you in a second. Hello Sheila, we're back. Like I said, I've brought in a medical staff, Michelle right here, who's going to be chaperoning and just making sure that I'm not doing anything that I'm not supposed to be. Okay, and I also see that you've removed your trousers, which is perfect. So now I'm just going to have a look at your varicose veins and palpate for any other abnormalities on your legs. I'm going to start on your left first. Okay, it's quite tender right there, isn't it? That's where your varicose veins is. I can see that I can feel that it's cord-like, and it's deep into the skin. I can also see the redness that you've been talking about earlier. That's correct. It's good that it's only swollen and red around the varicose veins and not your entire leg, because that would indicate something else. That's good. Now I'm going to move on to the right leg. I can see that there's no abnormalities here. Now I'm just going to do the same examination, but when you're lying down, okay? Right. I feel the same varicose veins on your left leg. I'm just going to check that it's not near the femoral vein, near the groin, okay? Okay, it's not there. That's a positive sign, okay? And can you please sit down? Yeah, you can just sit down on the table for now. I'm just gonna check your breathing. Right, I'm just gonna use my stethoscope to see if you're breathing normally. Okay, perfect. And do you feel any chest pain? No, like you said earlier, there wasn't any other pain that you experienced. That's good. And now I'm just gonna use this thermometer to check your temperature. Normal temperature. And I could also see that there's no abscess on your legs, which rules out infection, okay? Okay, we can go back to the desk so I can ask some more questions to discuss your condition. Is that okay? Okay, I'll be waiting. You can put your trousers back on. Thank you. Okay, Sheila, are you alright? And do you have any questions? What are varicose veins? Okay, let me just draw a quick diagram for you. Okay, so as you can see here, this is the vein. They're the blood vessels that bring deoxygenated blood back to the heart. Veins work against gravity, and they also allow blood to go in a one-way system back to the heart with the valves that you can see here. So these valves, they open and close. Open to let the blood through, and then close to keep the blood going in a one-way system and not backflow. But sometimes the valves weaken, and as well as the walls. So if the valves are not going to shut properly, they're going to be floppy, and that causes the backflow and the leaking of the blood back to the downstream veins, okay? And that's what causes varicose veins, and that's what causes the swollen appearance and enlargement of the veins, okay? So that's what varicose veins is. Does that help? Yes, okay, I'm happy. Okay, taking in account the answers that you gave me, the information that you gave me, and as well as the examination that we did, I think it is superficial thrombophlebitis that you're experiencing. It's when the vein closer to the surface is inflamed because of a blood clot. So I have a few suggestions for you, okay, to take care of yourself. First, a warm, moist towel or flannel can be applied to the affected limb, and that would provide relief. So it's not going to hurt as much when you do that. And then the second one would be keeping your leg elevated when sitting, and that may improve the blood flow, the venous blood flow, and it might reduce the swelling as well. And the third, you should try to continue your exercises and keep your left leg moving, okay, to reduce the risk of deep vein thrombosis. I'm going to get a prescription for... Do you have any questions? Okay, so I'm going to get a prescription of paracetamol and ibuprofen for you to help with the pain, and we'll get you an ultrasound scan appointment to look into your veins. Then we can decide what treatment is best for you, okay? Does that sound good? All right, okay, I'll see you after your ultrasound then, okay? Hello, Sheila, how are you feeling? Good? The paracetamol and ibuprofen's working? That's good. Okay, so we have your ultrasound scan back. Do you want to see it? Right, Sheila, this is your ultrasound scan, and this is your great saphenous vein. As you can see, it's not a complete black tube. There's an impediment right there, which is the blood clot, and that's what causes the pain that you're feeling on your legs and the tenderness in your veins, okay? That's called the superficial thrombophlebitis. Okay. Do you have any questions? No? Okay, so now we're going to talk about the treatment plan, okay? So there are effective medications to treat this condition, and from seeing the scan and looking at the clinical history, I think that the low molecular weight heparin will work well for you. This will prevent a recurrence of blood clot and prevent other complications like DVT. So I'll get your prescription ready for you, and I hope you get better soon, okay? Okay, take care now. Bye.